Okay.
Hi, my name is Dayomi. As you all know me, I've been doing this for almost 12 years. What I usually do is I consult patients, I work with cosmetic plastic surgeons, and I work for a cosmetic plastic place. Now, a lot of patients send me text messages on Instagram, Facebook, asking me, Dayomi, what's a BBO? When can I do a BBO? What should I do before and after the BBO? How can I get better results? My answer is working with all these doctors, every doctor has a different way of doing BBOs and has a different answers what to do before and after the BBL. But one of the main thing before the BBL is most important thing, your BMI has to be less than 34, cannot be more than 34. There's doctors that do BBL for more than 34 BMI, but I suggest less than 34 so you guys could have better results. Send your pictures to your coordinator. Send them your medical history. Make sure you don't have any problems in your past medical history. Make sure you don't have any UTI. Make sure your hemoglobin is in 12. To be able to know that, you should go to your PCP at least 3 weeks before your surgery or before you start paying any money to these coordinators, so that way you know your hemoglobin is fine and that you don't have any infection like a UTI, which is a urinary tract infection. That you could always go to your primary doctor and just have an evaluation, a checkup, and that way when you travel, you don't have to postpone your surgery. Your surgeon could do your surgery with no problems. Before surgery, patients should not do any drugs at least 3 or 4 weeks before surgery. No marijuana, no cocaine, no alcohol, no medications that has aspirin, and of course no diet medication, not even Herbalife, nothing. So 4 weeks before the surgery, patient should be off medication. I mean, if you have a mandatory medication, just ask your primary physician or ask your doctor. Those medications don't stop until you ask your doctor. What happens when you come and you having the surgery done? You should come a day before your surgery. You should meet your doctor. If you can meet them before, you should come. You should bring a witch picture so that way you can show your doctor what are you looking for. Obviously, every person has a different anatomy, different bone structure, so nobody it's going to be the same. After that, you should have your surgery. A lot of doctors recommend to sleep in your belly. Other doctors like for you to sleep in your back with a special bed that supports your butt with pillow or with a hole in the middle. Now, for that, you could always buy it. You could always go to Walgreens or any place that sells those chairs that you use for the beach, and you just open a hole around, or you can bring it and the doctor will do it for you. The most important thing is has no pressure in your butt. As long as you don't sit down and you don't sit in things that are hard, your butt it's gonna stay the same. Usually 30 to 20% goes away, but if you follow all the instructions as your doctor say, you will have the best result. The garment is really important. The phones is very important. The garment may get loose after 3 or 4 days. You need to start buying another garment, and at least get 3 garments after your surgery. But the most important thing is to use your garment at least for the 3 months with the phones inside. No exercise, no sex, no heavy lifting, no more than 10 pounds, at least for the first 6 to 8 weeks. After that, you could go back to your routine life. Driving. You should not drive as long as you're taking any medication, which is the Percocet or the painkillers. So do not drive when you're taking those medications. But if you drive after those medications, try to buy a bobby pillow, or you can buy a towel and wrap it around and put it under your tights, and you could sit on that. As long as you don't sit on anything hard, you could always drive or sit down. Other questions that patients like, oh my God, I'm losing my butt. It's getting smaller. Remember, everybody's different and we have different anatomy. So not everybody's going to absorb the same fat. Some fat goes away. Some patients do not absorb the same fat inside. So sometimes patients need round two, and that's when they get the best results. A lot of patients do complain, oh, my skin is a little soft, it's not tight enough. Remember, if you were a patient that had kids before, your skin is already stretched out. So yeah, it's going to retract a little bit, but it's not going to retract 100%. So as long as you use a garment and follow the instruction, your skin should retract at least 60 to 70%. Always follow your doctor's instructions. Always ask your coordinators to send you all the reports and what the doctor wants you to do. And remember, every doctor has a different protocol about the BBL. The same thing goes with breast augmentation. There's no driving, there's no heavy lifting for more than at least 6 weeks, I will say. Most of the doctors say 6 to 8 weeks. We say here in Seduction Cosmetic Surgery, we say 6 to 8 weeks. There's no driving, there's no heavy lifting. But before you have all those answers, you need to consult with your doctor and he will give you the right answer. The coordinators could also send you a detailed list with everything as the post-surgical instructions and the before-surgical instructions. Things you do need to know about your before. Remember, you need to check with your PCP. You need to make sure you're in good conditions. You need to make sure you don't do any drugs, that you don't smoke, that you don't have no cocaine in your body, that you don't drink any medication that has aspirin, and of course, no diet medication. After surgery, just follow the instructions and don't sit down if you haven't done a BBL. Tummy tuck. Tummy tuck is like having a C-section, but most of the patients say that having a C-section is more painful than a tummy tuck. For tummy tuck, there's no heavy lifting, there's no running nor exercising for the first 6 to 8 weeks. The recuperation is better because you can sit down, you can go to work if you work in an office. The only thing you're not allowed to do is more than 10 pounds. And you're gonna have probably a drain. The drain is removed in 7 days. Those drain, we could always show you, or you go and the medical assistant and the doctor will show you how to take care of it. Most of the time, the doctor removes the drain in 7 days, but you have to drain less than 25 for him to be able to drain. Please follow that with your doctor and the medical assistant or the nurse, because it could get infected if you don't give them a good care, because the incision could get infected. Try to keep your skin clean, trying to spray alcohol. Just follow the doctor's instructions. You guys know me already. You guys could look for me on Instagram, which is Diomi624, and you guys could welcome to ask me any question. Doesn't matter if it's the doctor I work with or it's any other doctor. I believe all the doctors are amazing and they're gonna give you the best results as long as you bring your witch pictures and you follow the instructions. Thank you and nice talking to you guys.